Hello everyone, hi, my name is Fatima. I'm from IFMSA Guatemala and I'm the SCORA director for the term 2020-2021. So sadly here in my region, here in my country, the people living with HIV is still facing a lot of stigmatization, is still facing a lot of discrimination actions, even inside to the health services. After the COVID-19 situation, the people living with HIV is not a priority for the health services, it's not a priority for the government because all the efforts are right now focused in fight against the COVID-19 chaos. Because unfortunately here in my region, here in the Americas, we are still facing a lot of issues and a lot of obstacles regarding to this situation. So right now, sadly, we don't have any update, we don't have any information regarding to the real status of the people living with HIV, and of course we don't know anything about the 90-90-90 strategy. So probably the situation is worse than the beginning of the pandemic. Probably the people living with HIV is facing more obstacles to have comprehensive access to antiretroviral treatments because right now all the hospitals are just having COVID-19 pills, medications, and that's it. So I don't know, we don't know what is the current situation, and the only thing that we know is we still have so many things to do, we still have so many things to change in order to create a comprehensive environment for the people living with HIV. So I challenge medical students around the world to continue fighting for the elimination of the stigmatization and discrimination against the people living with HIV. I challenge you to continue contributing to the distribution to the 90-99 strategy information because so many people still doesn't know anything regarding to the strategy, and probably we still have so many things to do in order to accomplish this strategy. So please continue discussing the HIV topics. Please continue with the advocacy actions because we can do the difference. We can do a huge change and we can do something for the 90-90-90 strategy, but we need to work together. So again, I challenge you, if we unite our voices, we can do it. So, yo soporto la estrategia 90-90-90. A huge hug from the America's heart, from Guatemala, and bye.
Hello everyone, my name is Francisco and I am the nota for ANEM Portugal. When it comes to the 90-90-90 goals, Portugal has a great outcome. So for the first goal, we have 92.2% of people diagnosed in our country. Of those, 90.2% are under treatment, reaching the second goal. Our third goal is in fact the one with the biggest percentage, considering we have 93% of people diagnosed and under treatment with viral suppression. So these results leave us quite satisfied, but we still need to work to push these percentages further and reach the 100% as soon as we can. During the COVID-19 isolation and quarantine, access to treatment was increased by ensuring people living with HIV and AIDS could access their medication in community pharmacies and not only at the hospital. That was the norm prior to this situation. So I challenge all of you, medical students, colleagues, friends, peers, to keep spreading the word, raising awareness and fighting discrimination against people living with HIV and AIDS. Eu apoio as metas 90-90-90.
Hi, my name is Eric Nyongira. I'm from METSA, Rwanda. Regarding the UNAIDS 90-90-90 targets, Rwanda stands at 84, 98, and 90. People living with HIV and AIDS during the COVID-19 pandemic were supported specifically through different measures established, where in some means they were delivered with their antiretroviral medications at their homes, and some were given socio-economic support through the food relief and the other means of supporting them. I challenge the medical students worldwide to stand in solidarity with people living with HIV and AIDS, where they should stand still to defy the stigma and discrimination against people living with HIV and AIDS. kigikiye intego za 90-90-90.
Hi, my name is Nadina Buzaid and I am the Nora of the term 2020-2021 from CIMSA, Qatar. Regarding our updates on 90-90-90 agenda status in Qatar, unfortunately this information is unavailable to us, mainly to maintain the confidentiality of patients and people living with HIV and AIDS. Regarding the access to healthcare services during the pandemic of COVID-19 for people living with HIV and AIDS in Qatar, there was actually no interruptions in the delivery of these healthcare services. In fact, sexual health clinics were run smoothly and efficiently by the doctors during the pandemic. Patients were not allowed to come in person to the clinics as per the safety precautions implemented by the government. Any medications prescribed or visitations required by the patients were only permitted according to the health status of the patients. I challenge medical students to educate themselves, their family, and their friends about the struggles that people living with HIV and AIDS face daily during the pandemic of COVID-19. أنا أساند استراتيجية الأمم المتحدة 90-90-90 لمحاربة فيروس نقص المناعة البشرية.
Hi, my name is Indra. I'm not of SCORAngels CIMSA Indonesia. Talking about HIV and AIDS, when it has been determined 90-90-90 program. For the 90-90-90 goals, Indonesia has set an estimate goals that could be relevant on 90, X1, and 73. That means 90% people living with HIV and AIDS know their status, 81% of them get antiretroviral therapy, and 73% has decreased the viral loads. But in June 2020, we have reached 63, 25, and 3.8, meaning that Indonesia is still far from achieving this target. The COVID-19 pandemic causes people living with HIV and AIDS scared to go to the hospital to access the antiretroviral due to their immunosuppression. In April 2020, the number of ARV in Indonesia was decreased, but now it has been stable. I dare you medical students to join this campaign to educate your closest one to increase the public awareness and also advocate the stakeholders. Saya mendukung program 90-90-90.